with Mr. Ravi Mehra from Mehra Eyetech, a TOPCON group company. So welcome to your interview with Optician India. First of all, I would like to ask you, how has been your experience in the optics fair this year during this time?
Well, Priyanshi, today being the first day, we generally do not expect too many people to show up in the Punjab Optical Show on the first day. And tomorrow being Sunday, we are expecting a very large crowd to come in. So I'm sure that eventually the show will be very successful. And by Monday, I'm sure we will give you a very perfect picture about how has been the show. But as usual, the show is generally very, very good for the traders and for the exhibitors.
Of course, there has been a lot of research in the technologies for eyewear, for its equipments. How do you think has the market been reacting to your equipments, to your company and your equipments?
See, the market is evolving, technology is evolving, there is no doubt. From the manual refraction, we went on to the auto refraction. From auto refraction, we now have computerized refraction. And we have devices which are automatically refracting the patient's refractive error. And the future, if you ask me, is more connected with remote refraction. Because India needs a very, very large number of optometrists. And while the number of optometry schools are growing, the number of students are growing, but still the speed with which the demand is increasing, we are not really able to cope up with the optometrist in our country. So technology is taking us one step further, and we are now going to be doing remote refraction, which means that the very large operators will have control rooms, something like a back office, where there would be a few number of optometrists sitting, and they would be connected directly by the internet with various shops. And when a patient walks into the shop, then he will be refracted remotely. So when he is refracted remotely, then the optometrist's time is not really wasted. So each one can handle any number of optical shops. So instead of having one optometrist sitting idle in one shop, you can have one of them attending to 10 shops at any given time. So that is what is the future about.
I think as we're talking about the future, we also have the myopia control workshop going upstairs with our students.
Yeah.
How do you think should those students be encouraged to take up the field of optometry and actually pursue the technological part of this field? Because there are many sellers, but they are not quality sellers. So how do we motivate them to become that kind of quality sellers?
See, myopia, as was mentioned this morning by one of the speakers, that it's the new pandemic in eye care. So the new pandemic in eye care has been more, it has kind of generated much quickly over the last 3 years, primarily due to COVID. What has happened is children and adults have all been sitting indoors and have been spending most of their time on the screens. So whether they be the phone screens or the television screens or the computer, laptop screens. So the incidence of myopia has grown very tremendously. And to control this, or to that matter, to treat this, now even we at TOPCON and Mehra Eyetech, we have introduced a new device called the MYAH. So MYAH, as you know, goes more with myopia.
Yes.
And we are also having a session for the students this afternoon and also for the opticians tomorrow. So we will definitely be telling them about how to measure and how to control and what are the corrections that need to be done and to see the progression of the disease. So there are new devices, and as TOPCON we are introducing a new device called MYAH, which will be definitely very helpful to the opticians and to the market and to the people at large.
Yes, of course. Also, sir, I would like to ask what are the contributions of your company towards smart movement, like smart glasses, smartphones. What is the new smart for you?
The news part for me would be, that we would be the first ones to introduce remote diagnosis. So you can imagine if one optometrist can do the task of 10 optometrists, what could be more smarter than
That is very great, I think. That will be great for the people who are actually in need of good optometrists in this
Yes.
country.
that? Yes, because as you know, we talk about robotics, we talk about robotic surgeries. So now, even for refraction and even for diagnosis of the eye, it's all going to be done in robotics.
Thank you so much, sir.
You're welcome.
That
Thank you, Priyanshi. Thank you for having me. Thank you so much.